Hi everyone, I'm Connie. Today I will be presenting on a contemporary issue in nursing education. Let us begin it with a question. Should continuing education for nurses be mandatory? Nursing is a profession committed to providing safe, high-quality care to patients, family, and communities. In an era where healthcare is rapidly advancing, patient equity is increasing and technology is evolving at an unprecedented pace. Nurses are expected to constantly adapt by updating their knowledge and skill. So mandatory continuing education is often presented as the solution, a safeguard to ensure competence and patient safety. But here lies the controversy. For nurses who already work long hours, face staff shortage, and earn modest salary, does mandatory continuing education truly represent professional growth, or has it become yet another burden imposed on an already stretched workforce? So in this presentation, I will discuss about the concept of continuing education in nursing, argument for mandatory continuing education, argument against mandatory continuing education, and finally the conclusion and recommendations. First of all, continuing education is widely defined as a lifelong learning process that extends beyond initial formal qualification. For example, in Malaysia, completing formal education means that the individual have already finished his or her primary school and secondary school and get his SPM certificates already. Then if that person continue his education in a college or university, taking a degree or master degree or a PhD, it means that continue education. While in nursing, continuing education refers to the ongoing educational activities that nurses engage in after their basic training. For example, a nurse finished his diploma or degree in nursing, he already started working for some time, and now he wanted to improve himself with the skill and knowledge, and he go for a post-basic course. This called continuing education in nursing. So according to the Commonwealth Nurses Federation 2014, continuing education can be divided into formal education and non-formal education. Then example of formal education are like accredited courses or certification programs, and example of non-formal education include workshop, seminar, conference, and in-service training. Even if the informal learning like reading journal, reflective practice, and self-directed learning are also considered as continuing education. From a regulatory perspective, continuing education is not merely encouraged, but it is enforced. Regulatory bodies argue that lifelong learning ensures nurses remain competent, accountable, and safe practitioners. However, from the nurse's perspective, the experience of continuing education may look very different. And this brings us to the first side of the debate. Let's begin with the strongest argument in favor of the mandatory continuing education. First, mandatory continuing education is an essential for renewal of annual practicing certificate, which is also known as APC. Since 2017, Malaysia has implemented mandatory continuing professional development for nurses. Continuing professional development, in short form we call it as CPD. This CPD is directly tied to the renewal of the APC because it records the participation of nurses in educational activity based on time and sessions attended. And nurses are required to accumulate a minimum of 20 CPD points every year to renew their APC. And failure to meet this requirement does not simply delay the career progression only, but it also can result in loss of APC, loss of their nursing license, and also their employment. And to regain this nursing license, the nurses have to retake the LJM licensing examination. Therefore, continuing education is not optional, but it is essential for nurses to remain legally employed and practice professionally. It acts as a regulatory safeguard, ensuring that only nurses who maintain minimum professional standards are allowed to practice. This protects not only patients, but also the credibility of the nursing profession itself. Secondly, mandatory continuing is an essential as it maintains professional standards in a rapidly changing healthcare field. The healthcare field is constantly evolving. New medication, new technology, new treatment protocols, and evidence-based guidelines emerging continuously. Keeping up with the latest research and best practices is increasingly challenging. Without ongoing education, nurses are at risk to practice with outdated knowledge. Therefore, nursing education should not stop once a nurse receives their license. After 2 to 3 years of working experience, nurses are often encouraged to pursue post-basic training or specialty courses. Examples of nursing specialties include critical care nursing, emergency nursing, pediatric nursing, oncology nursing, mental health nursing, pre-operative nursing, and many more. Continuing education focuses on support evidence-based practice, enhance clinical decision-making, promote patient safety, prepare nurses for specialized role, leadership, and management. From this angle, mandatory continuing education is not an inconvenience, it is a professional obligation. If nurses are trusted with patient lives, then remaining competent is not optional. The third one, job security and personal benefits. Beyond patient care, continuing education also offers tangible personal benefits. Nurses who upgrade their qualification may have a better career advancement, like getting a promotion on leadership or specialist roles. They can also get a post-basic or degree allowance, and thus increasing their monthly income. They can also increase their long-term job security. In Malaysia, nurses who obtain post-basic or degree allowance or degree qualification may receive additional monthly allowance ranging from 200 to 500 ringgit Malaysia or even more. Thus, continuing education is not only a professional responsibility, but it can be framed as a strategic investment in nurses' financial well-being and career stability. At this point, the argument seems clear. Mandatory continuing education protect patients, strengthen the profession, and benefit nurses. But is it the full picture? So we have to look at the other side as well. Despite its benefits, many nurses experience mandatory continuing education not as empowerment, but a professional burden. Nurses face several barriers that make lifelong learning difficult to sustain. One of the most significant barriers is time constraint. Nurses often work long, irregular hours. In Malaysia, private hospital nurses work 42 to 45 hours per week, often with rotating shifts depending on service needs. Staff shortage even worsened the situation. The workload is intensively heavy, the schedule is inflexible, the staff face difficulty in obtaining study leave. This condition make it difficult for nurses to balance work, personal life, and further education. Adding academic responsibility on top of demanding clinical work can negatively affect work-life balance and contributing to burnout. The second major barrier of continuing education is financial constraint. Continuing education is rarely free. It involves tuition fee, course materials, examination course, and sometimes the nurse further study at somewhere far away from their hometown or initial working place. They need to bear the transportation fee and pay extra for the accommodation as well. And yet many nurses earn modest salaries. A striking example from Malaysia reveals that a nurse with 14 years working experience earned a basic salary of only 2,600 ringgit Malaysia per month, and if adding on with the allowances, it only like around 3,800 ringgit Malaysia. With the rising living costs, balancing family responsibility and education costs becomes nearly impossible for nurses who are primary breadwinners, especially without scholarship or employer support. So low salary, limited financial aids, and high education costs discourage nurses from engaging in lifelong learning. So where does this leave us? On one hand, continuing nursing education safeguard patient safety, maintain professional standard, and enhance career prospect. While on the other hand, the mandatory continuing education can be experienced as a burden due to the time constraint, staff shortage, financial constraint, and limited institutional support. These realities cannot be ignored. The problem, therefore, is not whether continuing education is necessary, but it is focused on how it is implemented. In conclusion, mandatory continuing education is not the enemy, but the poor implementation is. For continuing education to be truly effective, the Ministry of Health must collaborate with healthcare institutions and nursing education providers. More nurses are needed to recruit to solve the issue of nursing staff shortage first, so that the nurses who meet the requirement can continue their education as soon as possible with less burden. Next, the flexible study pathway and protected study time should be introduced. Further research is needed to understand organizational barriers so that more flexible study pathway can be expanded. Other than that, the employer should provide financial support, scholarships, and study leave for the nurses. For example, the hospital can send the nurse to post-basic training, continuing paying their basic salary every month, and once the nurses completed their post-basic, they can ask the nurses to further contribute to their company for another 5 years in return. As example, by doing so, the hospital can secure their experienced, skillful nurses, and for nurses, their job is secure also. At the individual level, nurses can adopt time management strategies. For example, implementation of self-directed learning strategies may help nurses balance work and education. However, responsibility shouldn't fall on nurses only. Healthcare system must also provide the conditions that make the learning possible if they demand lifelong learning. Sustained commitment to continuing education is essential to ensure nurses remain competent, confident, and responsive to the rapidly evolving healthcare environment. With adequate support, continuing education become powerful tool which strengthen nurses, protect patients, and future-proof healthcare systems. That's all from me. Thank you.